And let's now shift focus to the United States, where the Health Secretary, Robert F. Kennedy Jr., is facing criticism over his decision to fire the vaccine panel. Current and former employees of the Center for Disease Control took to the streets outside the agency's Atlanta headquarters. Protesters held placards saying, "Save lives and save public health." The demonstrations coinciding with the first meeting of Kennedy's controversial new advisory committee. Kennedy recently fired all 17 members of the CDC's advisory committee on immunization practices and appointed his own picks to replace them. At least 2 CDC staffers have resigned in protest of this shakeup.
There have been rallies here every Tuesday since March, but today is especially important because it's the first meeting of this new, and I would say bogus, Advisory Committee for Immunization Practices, ACIP. Kennedy, as most people know, fired the previous members of ACIP, and the few people that he's put on it are not competent.
The Immunization Committee's recommendations shape the official U.S. policy as far as immunization is concerned. And the newly appointed committee has said that it would review the use of older vaccines and re-evaluate immunization timeline for children and teens. Now, critics are saying that the new timelines could undermine decades of science-based guidance.
Science should serve the public, not politics. That public health is a right, not a luxury. And that people inside the agency must be allowed to do their work freely, transparently, and without fear. The stakes have never been higher. We all know vaccines save lives. Science protects communities, and public health is worth fighting for.
And in another sweeping policy change, he announced that the U.S. will halt contribution to the Global Vaccine Alliance. With America being one of the biggest donors, its pulling out from the Global Vaccine Alliance will be hitting the agency's operations hard. And let's go straight across now to our correspondent, Susan Teherani, who's been tracking those developments very closely. Susan, a lot at stake, also a lot of concern over what might follow, because, we're talking about critical issues to do with the health of children and teens over here. But just explain to our viewers why this move was undertaken, because it's important to also contextualize the Health Secretary's tricky equation as far as vaccine safety is concerned.
Yeah, that's such a valid question, Molly, and I'm so glad that you brought it up. RFK was concerned that of this 17-member panel, the majority of them had conflict of interest with vaccine companies and pharmaceutical companies. And just as, these pharmaceutical companies lobby at Congress, for example, they could have the potential of making recommendations and lobbying because of the conflict of interest with this panel. This is RFK Jr.'s elaboration on the issue, and he's replaced them now with only 8 members. However, now there is concern, notably by the American Academy of Pediatricians, that these 8 members, they may not have conflict of interest, but they're known to be, quote unquote, vaccine skeptics. And so that's why we see sort of this debate, and also the demonstrations and protests that we've been seeing in recent days outside of the office, the immunization office, by parents and those that are concerned that perhaps his moves and what this panel recommends will create not only vaccine skepticism, but sort of a confusion about what to do next and what vaccines are effective and what aren't in the days and weeks and years ahead.
Indeed, Susan, we're leaving it there for the moment. Thanks very much.